after hearing from Dr. Engel and Ms. Scardaci and Dick about how important and how integrated Healthy People is at all of these levels, it leads me to Dr. Baase. Now, these three are what I would call usual suspects, right? You've got the state health officer, the county official, and the academician. But here we have an industry leader, business, industry, not usually in the realm of what we think about when we think about public health operatives. But I want Dr. Baase to share with us what she has been doing with Healthy People at the Dow Chemical Company.
Thanks, Penny. Well, we've been focused on what many people would think of as public health objectives for quite a long time, and I hope that more and more this is part of what's considered as the usual suspects, and that we fully embrace this. I think, you know, Healthy People 2020, like Healthy People 2010 and before it, these have been going on for a while, right? And we recognize the value of that in aligning and convening people around these priorities. But the nature of how significant and daunting the challenge is still out in front of us. I mean, we unfortunately have not solved all of the challenges. And I believe that in order to make the progress we need, we're going to have to embrace so many parties to be involved. And I think certainly we recognize schools and the business community and workplaces as key focus areas where we're going to have to meet public health objectives through those channels as well. And just as in, examples of Healthy People in our organization, we have a corporate health strategy. We've had one in place for quite a number of years. It's built on a business case, and it's focused on our entire population of Dow people. But we've used the Healthy People serial versions for the 10-year cycles to help us with strategic planning, the selection of measures, picking targets. What are logical targets? How far should we try to get in what sort of time windows? And really to understand benchmarks, like, well, where are we compared to where we might want to be? That really has served us well. And like the Healthy People, we set 10-year goals. They're not actually coincident with the same time window, but they're 10-year goals, recognizing that these aren't short-term projects. This has to be a sustained effort. And to reinforce the validity and the wisdom embedded in some of these goals, just to pick the healthy workforce objectives from 2010. There was two overarching objectives. One, that 75% of workplaces would have comprehensive health promotion programs, and that 75% participation rates would be achieved by those organizations. Well, I think we have at least 75%, probably 90% of companies would say they have health promotion, but it's that small, tricky word of comprehensive, which is the challenge we still have before us. And I think it's less than 10% who've actually made that true comprehensive achievement. But in our case, we believe that we have. And it's, in fact, a corporate policy mandate that every site must have a comprehensive health promotion program. And that corporate policy has been in place for quite some years. We do achieve and exceed 75% participation. Last year, we had 83% of our entire population participated in one or more of our programs per year in that year. And within the other specific example of a healthy worksite objective, the reduction of injury and illness at the worksite, we set a 10-year goal window that ended in 2005, and for that first 10-year window, we reduced worksite injury and illnesses by 80%. Our second 10-year window then started in 2005, and we've reduced another 33%. So that right now, our employees are 19% less likely to have an injury than any other manufacturing work site. But the other thing I just wanted to bring up is that it's not just about our own employees. Our corporate strategy has led us to recognize the importance of working in the community as well, not just on our own employees. So communities where we have a significant population, we actually have community strategies, which you mentioned in my introduction, that I'm chairing a 14-county, multi-stakeholder, not-for-profit effort in central Michigan. And we are setting community-wide goals with all stakeholders under, really, we're working as a triple aim initiative right now. But the Healthy People objectives are really critical in that how do we select what to work on? What do we focus ourselves on? And on December the 15th, we'll have our final all-day community-wide goal selection, again, across this 14-county region. So I think there's some power in this that's at the work site, but also how business can be a really helpful agent at the community level and in partnership.
Thank you so much. All of us say and know that it takes everyone. It takes all sectors to achieve the goals that we have for our nation. And I think that Cathy has really made a difference at Dow Chemical, and I'd like to clone you and send you out to all businesses across our nation and hope for that kind of success. I have a few more questions for the panelists, and then I believe we're going to take your questions and questions from those who are watching us via the web. So, Dr. Engel, how did North Carolina specifically use Healthy People related to needs assessment and identifying evidence-based strategies at a community level?
Right, we're very excited about our Healthy People 2020 initiative because, as Dr. Fielding said in the first hour, we used a true logic model to get there. And it began with our North Carolina Institute of Medicine as a partner and philanthropic donations from the Kate B. Reynolds and the Duke Endowment and the Blue Cross Blue Shield Foundation and others to fund an initiative that led to the Prevention Action Plan for North Carolina, which is a document of evidence-based strategies known to work at the community level for really addressing the big health problems in North Carolina. So working back in the logic model, we needed first to understand what those needs were in our state. And we know what the major determinants of disease are. If you look at the top three, it's tobacco control, overeating, and not enough physical activity. So those were the easy top three to go after. Then underneath those, you can develop action plans that are evidence-based to do something about it. But they have to be implemented at the local level because I'm not going to be able, again, to do it in Raleigh. Again, we offer technical assistance, we measure outcomes and help communities with their data, but it's really ultimately that local community that we'll have to implement. So we're very proud of the tradition in North Carolina on supporting local partnerships and ensuring their success and making them sustainable because unfortunately, like most states, we're broke, severely broke, facing a big deficit this year, and there are very limited resources. So the question is, how do you leverage that community to keep things going and keep them sustainable? It turns out that most of the money is in, as usual, the private sector, and that's how I think the local partnerships are really going to ultimately succeed. Taking advantage of the Affordable Care Act and the community benefit dollar that hospitals now must report to the IRS in ACA. Fortunately, North Carolina, almost all the hospitals are nonprofit and therefore have to fulfill this provision of doing a community needs assessment every 3 years, according to ACA. We're going to try to develop partnerships with local health departments and other community stakeholders to leverage those community benefit dollars that hospitals get as an IRS refund. That's real money that can go into real community development and sustainability for implementing the evidence-based strategies at the local level.
Thank you. North Carolina has been a leader in using Healthy People to advantage its citizens. And you've brought up a very interesting topic, and that is budget. And so I wanted to ask Rita, during times of economic challenge like we have now, how have you used the local platform that you described based on Healthy People for budget planning?
That's a great question, and we're all facing these issues of diminishing resources at a time of such high need and priority. In Sonoma County, we've used the Network of Care for Healthy Communities along with some community action. And the community action was the development of a council called Health Action that used the Healthy People 2010, and we will be updating that with the Healthy People 2020 data to set up an agenda that was approved by the Board of Supervisors and really embraced by this broad council of health professionals, businesses, education, labor organizations, consumers, to really prioritize where would we invest these limited resources. And as Dr. Engel said, using the data for California and certainly specific for Sonoma County, we worked on 3 or 4 areas that we believed would make the biggest impact in the shortest amount of time. And again, they focused around healthy eating, active living, and access to a prevention-focused, integrated primary care. And we had wonderful partnership from our hospitals who, as Dr. Engel mentioned, are interested in their community benefit assessment and have partnered with their local health jurisdiction in a positive manner, as well as education and business. And we were able to cobble together, between all of these partners and some local funds, a budget that has made successful interventions possible within our community. Some of the things that need to happen at a community level really don't take a huge amount of money. You can do, when the community is ready to move and they want to come together and mobilize, it's really an exciting opportunity for your local health jurisdiction and local partners to align ourselves with what they see as the activities. And so we talked earlier about what was the role in faith-based organizations. And through Health Action, some of our churches came together with their congregations and their leadership to plant community gardens and to work with their members to really make healthy food available and healthy vegetables available throughout the week in their churches. And it was not an expensive way to really start some movement in communities towards achieving Healthy People 2020 outcomes.
That's just wonderful to hear, that empowering communities to care for themselves is a part of what you do, and a way that Healthy People reaches out to individual citizens, making it alive for them. And that's wonderful news. I thank you so much for that. And Dr. Riegelman, what do you hope to accomplish in this next decade with the Healthy People Curriculum Task Force?
Well, first of all, we are delighted to see the development of the new website. It really opens up all kinds of opportunities to really not only get the word out, but get the word in. And I think that's going to be increasingly important to really make some connections. The idea that there actually is one-stop shopping that opens the door to data, that opens the door to interventions, that organizes the 530 objectives into a coordinated way. We see the Education for Health framework as it develops, and we now have support from the Office of Disease Prevention and Health Promotion, and with APTR, the task force intends to develop our Education for Health framework so that it will be part of that website, and that we'll be able to click on one of the areas of undergraduate public health or clinical prevention of population health. And guess what? Behind there will be more, and there will be opportunities for finding the resources, finding the connections, developing the networks, and really having a way to get into I also am pleased to hear that there will be now a return to looking at some leading indicators, and that the Institute of Medicine will be reporting on that in terms of being able to provide some ways to really focus the attention, and we've seen how important some of those areas are. So we hope that there really will be a way to access the system and coordinate the system and get us all talking.